귀요미 귀요미 초코머핀 한 조각 시켜놓고 고소한 우유 한 잔을 기다려요. 오빠하고 나하고 꼭 마주 앉아서 서로 손바닥 위에 예쁜 낙서를 하죠. 한눈 팔지마 누가 뭐래도 내꺼 다른 여자랑 말도 섞지만 난 니꺼 새끼손가락 걸고 꼭 약속해줘요. 절대 나 혼자 내버려 두지 않기로. 일거기는 귀요미
What's up, Naki?
Hey.
Look! How much you are already smoking? Do you want to die? You always be a heavy smoker. So disgusting.
It's okay. It's relaxing me.
But
Want some?
of course lah. I really stressed nowadays. It's so refreshing, you know?
Power, I need to do exercise lah.
You look fat.
Yeah.
You do. Yeah, Naki, don't joke around.
No.
Exercise.
My
I
chest.
know.
My chest is hurt.
Naki, if this is some kind of joke, I will kill you.
It hurt.
Are you serious? Naki,
You think I'm joking?
you always like this. Naki, let's go to the hospital. Wake up. Wake up. Nurse. My friend.
My chest.
Something wrong.
My chest.
Him. Are you okay? What's wrong with him?
My
His
chest.
chest. He's woke up, nurse. Let me check his blood pressure. Masya Allah, brother, what happened to you? Your blood pressure is normal, but why are you in pain? That's funny. Call the doctor.
Nurse Iza, Nurse Wani, please put the cable on the patient hand. Okay, Mr. Nakib, actually you are having angina pectoris and I will prescribe to you nitroglycerin. Nurse Iza, you will give it to him later by within 5 minutes, okay? Please prescribe the medicine immediately and give it to the patient by instructing him to put under the tongue. Thank you.
Please give it to Mr. Nakib. I need to go to toilet. Are you comfortable, sir?
Yes.
Hi, Assalamualaikum, sir. I am Nur Farahia from IUM. I will give you medication to reduce your pain. So here is your medication. Okay. Here's your cutter. Okay, done? Not yet. So you can have your rest right now.
Okay,
Thank you, sir.
Nakib! Hey, what's wrong with you?
I don't know, my
Are you
chest is
already
hurt.
eat the medication?
Yes, yes.
Where's the doctor? Okay, I will find the doctor. Doctor.
Yeah?
Him, what's happened to him?
Oh wait, I'll check reading. There's something wrong with his blood pressure reading.
You die. Can you do doctor look at him? What happened? Can you do your work properly?
I'm so sorry. I will ask the staff nurse.
Alright, call the staff in right now.
Okay.
Staff nurse. Izzah,
Have you already give the medication that I prescribed to Mr. Nakib?
Yes, I already prepared the medication, but I asked Peya to give to Mr. Nakib.
What do you think you are doing? You are supposedly to give the medication that you have prepared by yourself.
Doctor, actually, my stomach is very hurt just now, so I can't hold it.
What?
I want to tell you something.
Tell me right now.
Okay, actually, I forgot to tell Peya about the pathway of the medication that Nakib's supposed to take. I think it doesn't affect anything.
I can't believe you. The medication is actually for sublingual, for faster result, you know? Your carelessness can kill a person.
I'm sorry, doctor.
Go and prepare the new medication for the patient.
Okay, doctor. Assalamualaikum. I'm Shariza. I'm going to give you medication to relieve your pain. You are Mr. Nakib, right?
Yes.
Doctor,
Yes?
this is the correct one.
Yes.
Okay, thank you, doctor.
Okay.
So, please put this below your tongue. Below your tongue, okay? You cannot drink water or spitting within 5 minutes, okay? Are you done? Okay.
Next is the right in drug administration. The first one is right patient. First, we have to ask the name of the client. We can ask the client himself or herself, or we can also ask the family members. Next, we also have to check the patient's wristband by checking a second piece of identification, which is medication administration record. This must be done before any medication is administered. Next is right time. We also have to check the time at which the prescribed dose should be administered to the patient. We also have to check the order for when it will be given and when was the last medication was given. We need to administer the drugs at the specified times. The drug may be given half an hour before or after the time prescribed if the administration intervals is more than 2 hours. Next is right dose. Every patient have a different dose of medication. The dose should be prescribed for a particular client. We need to calculate correctly and accurately. We need to check the medication sheet and the doctor's order before medicating. We should always consult a pharmacist or a peer if the dosage appears to be incorrect. Beware of pediatric dosage that are based on body weight. Weights can easily change, so regular assessment of dosage is crucial. Next is right drug. We have to check for the date and time the order is written, the drug name, the drug dosage, the route of administration, and also the frequency and duration of administration. We also have to check for the healthcare providers or physician's signature or name is present. If one of these components are missing, the medication should not be administered. And then we should also beware of adult and pediatric dosage. It is different for adult and pediatric. There are also some medications that have the same name but different functions or sound like medications. We also have to beware of that because these mistakes, misreading the medication names mistake, can lead to errors associated with verbal prescriptions.
Route of administration is the way in which the drug enters your body. It is generally classified by the location which the substance is applied and where the target of action is. Sublingual administration refers to which the substance is diffused by the blood through tissue underneath the tongue. It is usually designed for cardiovascular drugs because the action is faster and direct, and also to avoid them from being degraded by the bile or stomach acid. Right of documentation. It plays a vital role in the delivery of quality nursing care service through supporting better communication between the healthcare team members to facilitate the continuity of care and safety of the clients. The purposes of documentation is the written record of history, treatment, care, and response of the client while under the care of healthcare provider. Second, a guide for reimbursement of care costs. Third, an evidence of care in a court of law and show the use of nursing process. There are 5 nursing process, which is first, assessment, second, nursing problem, third, good, fourth, intervention, and fifth, evaluation. The quality of nursing documentation process is the procedural issue of capturing clients' data, such as nurse signature and designation, date, chronological orders, timelines, and regularity of dosage. Second, the quality of nursing documentation content is referred to the message from data about care process. It is concerned with comprehensive and appropriate. Third, the quality of nursing documentation, structure, and format is related to the constructive features and physical presentation. Records such as quantity, completeness, readability, and the use of abbreviation.
Okay, now I will talk about the advantages of taking sublingual medication. There are 3 advantages. First, avoid hepatic first pass. This is because there is no loss of drug by first pass effect. And second, rapid absorption, because the area have a good blood supply, so the medication will absorb rapidly. The last one is drug stability. This is due to the pH in the mouth relatively neutral, thus
the drug will be more stable.
For conclusions, we know that sublingual medication can be absorbed quickly, and it's also important during emergency such as heart attack. Besides that, this drug do not go through the digestive system, so that this drug doesn't metabolize through the liver. This means that we can take this medication with the lower doses, but with the same results. And this medication also don't have to be swallowed. This drug can be absorbed under the tongue, and it will be easier for the people who have problem in swallowing. We should check client's name, medication's names, right dose, and also expired dates before we give it to the patients. We also need to stay with the patients to make sure the patients take the medication with the right.
From the hadith, we can understand that we as a nurse do have the obligation to teach the clients the right way to consume the drugs. We should be more responsible to our clients, as if they are taking the drugs with a little knowledge, it may be dangerous for them. The drugs may not be as much as effective as it should be, or perhaps it will give the negative effect to the patients. So that's why we should teach our client the right of medicine, dosage, patient time, route, and documentation. And also we should give the patient the education and information.